Hi, Dr. Kelly Starrett with Hyperice. A big problem we see in the clinic is helping patients manage post-abdominal surgery, even postpartum recovery. And to that end, remember what we're trying to do here is appreciate that these tissues should be able to slide and glide, and as we tell our patients what part of the balloon is okay to cut, right? That when we put any kind of incision in the middle of this abdominal wall, potentially creates a lot of downstream effects. The other issue is like, how can we improve breathing, sort of proprioceptive uptake through these areas which people don't want to touch and maybe have undergone some recent trauma. But additionally, how are we going to help that person also continue to decongest their trunk if we see altered breathing and altered sort of downregulation, degradation of that contractile field system? So a sneaky way to get someone into sort of reclaiming their abdominal wall to be able to get some vibration in and just even sort of improve breathing and ultimately decongestion through lymphatics is actually by laying on the roller. So I'm going to have Diane here, working mother, actually be part of our example here. What we like to do is have our patients and athletes be able to modulate or work on some of these things at home. We're big fans of trying to improve our intersession change. And believe it or not, when we introduce percussion and introduce vibration to our patients, they obviously actually embrace this technology because it feels cool, but also it helps them to self-soothe because the vibration is a way of sort of dampening down some of the threat signaling to the brain. So in this situation, we can start by just even having Diane lay on the roller and just shift side to side and even take big breaths. Now, this roller may be too hard and it may be too soft. When it's in the situation of too hard, what we end up doing is just say, hey, put a pillow over it, put a blanket over it, roll up a towel on it, and just make it tenable so that you can begin a conversation about exploring the full excursion of the breath. So we can start to have sort of diaphragm excursion, abdominal excursion, and what happens on the ends of those things. So we're looking at the range of motion of what happens when we have a full breath of air in the thorax, and also what happens when we completely lose that ventilation and challenge those tissues without that sort of big bag of air support. But then the next phase, or sometimes even early on, is to go ahead and introduce a little bit of vibration. Here it comes, Di. So at the lowest setting, it's actually pretty tolerable. And these devices have a ton of horsepower, which is always great. But in this situation, even just a little bit of vibration can help Diane relax and sort of cover up some of those really uncomfortable feelings. Now, we don't have to be anywhere near the incision. In fact, we can be far away from the incision and still be getting appropriate loading through that tendon and even helping to realign those fascial fibers and those collagen fibers just through the vibration alone. So a simple way for Diane to improve her breathing, sort of threaten the tissue-brain interface and begin to restore her trunk function. So again, simple way to begin to initiate self-care at home. And this is a sneaky way that we love to incorporate the Vyper into our at-home patient care.